Welcome back to our series on the first 2 weeks after birth, and today is the final video. How the hell do I take care of a baby? We're going to go through swaddling, feeding, sleeping, bath time, how to take care of the umbilical cord, and a lot more. By the end, you will feel confident that you have basic understanding and knowledge of what to do and how to care for your beautiful baby. You feel a shift in your body when you understand something. I want you to just think about this for a second. When you are getting ready to get your driver's license, you have to study to pass the test. You have to practice. You have to prove that you know how to handle a car. And then you get given a temporary license where there are rules. Who can be with you in the car? When can you drive? Eventually, after practicing that for a couple of years, you get to be independent and drive the car by yourself. You get given a human being that you are responsible for helping them understand their potential and learning about their strengths and raising them to have values. This is a huge responsibility, right? And a lot of us go in it with zero training, zero classes. I went in with nothing and I felt so unprepared and I thought I'd just figure it out. And I wish I had gone to a class. So let's talk about the first day. You've had your baby and now you get to be with them. What do you do? What is normal? That first day, oftentimes babies sleep a lot. They're very tired. Birth is a process for us and for them. And they're in this new world with lights and sounds and air conditioning and smells. So there's a lot of stimulation for them. And what they want is to be with you. Skin to skin. Take off their clothes. Take off your clothes. Put them against your chest. Just hold them there. This is going to be so beneficial to them. It helps calm their heart rate. It helps improve their breathing. It helps with milk production if you're planning to breastfeed. There are honestly so many benefits to skin. So that first day, that's what you do right away. You put your baby on your chest and you hold them there. If you've had a C-section, your baby is most likely going to be separated from you for a time, and you receive medication to prepare you for the C-section. They gave you some medicine that makes you very drowsy, very sleepy. Your baby also got this. So most likely, a lot of C-section mummies say that their babies are very difficult to wake up on that first day, which makes feeding a little bit more difficult as well. I have a video on how to latch a baby. So you can click that one here to go through like step by step, how do I get my baby to actually breastfeed? Why do we want them to breastfeed on the first day? Whether you plan to breastfeed or not. Why breastfeed on the first day? Because of colostrum. You are making this milk that is thick and sticky, and it is packed with nutrients for your baby. It has white blood cells. It has lactoferrin. It has immunoglobulins. It has so much. It helps your baby just protect them from anything that's going around in the hospital, if you're at the hospital. And it just coats their gut and it sets them up to fight any infection that comes. It is the superfood. It is the greatest superfood in the world. And if you can give that to your baby on the first day, this is beautiful and that is amazing. And it's going to come out in drops, okay? You're not going to be like filling cups with it. Colostrum is really thick. Another benefit is that it helps them poop, which is where we get into jaundice. We have red blood cells in our body. These blood cells will die and they have to get cleared out of our systems, right? You don't want dead things in your body. You want it to get out. How do we get it out? We poop. Pooping clears that. And with babies, it's so important that they start to poop. So on that first day, they are going to poop this black sticky tar. And this is where colostrum also helps us, because colostrum helps a baby poop more easily. And if the baby is pooping and eating regularly, they have less of a chance of developing jaundice, which is the buildup of red blood cells, dead red blood cells, because it releases something called bilirubin in the blood, and that's when you start to turn yellow. So if you have white skin, you'll notice yellowing. Yellowing here, yellowing around the nose, yellowing in the eyes. If you have black skin, it's harder to see the yellowing on your skin, but you can see it on your eyes, you can see it inside the mouth. Adults can get this, but it's very, very dangerous. It's very dangerous for anybody to have this, but we want to watch out for babies because it is common to get some sort of level of jaundice, and we want to make sure it doesn't progress to a severe level. Asian babies have a higher rate of jaundice. So if you are Asian and you're having a baby, just keep an eye out on that baby, check them a little bit more, bring them out into the sunlight, and look at their eyes. But colostrum, breast milk, that helps reduce jaundice, and pooping. So let's get into pooping. All right, I put a chart below, or I'll put a chart here, which is going to go through what is normal poops and pees. The first day is this black sticky poop that is called meconium. And then, so they typically have a 1 poop that day. This is a really important poop to have. The next day, they'll have 2. The next day, they'll have 3. And it's going to slightly change in color from black to kind of like brownish, to kind of like a greenish, to a mustardy yellow. This is for breastfeeding babies. So this is what it's going to look like. It's not going to smell, which is really interesting. Breastfed babies' poop does not smell. It doesn't smell until you introduce food. Formula babies' poop will smell, and it will be different in texture and consistency. This is how many pees they should be having in the day. You want your baby to be peeing a lot. If you received an IV in the hospital, you most likely will swell up a bit because of the fluid retention, but your baby is also going to drop weight a little bit more quickly in the hospital because they have gotten that fluid retention while you're pregnant and they gave you an IV. So it is common for babies whose mummies had an IV before they were born to have a little bit more of a significant weight drop. Now your doctor is going to be watching them because they don't want them to drop more than like 8 to 10% of their body weight. While we're talking about poo and pee, let's also talk about how to change a diaper. So let's just imagine this little baby already has a diaper on. The first thing you want to do is take out a wipe and rub it along the inside, right underneath the line of their diaper. Rub it back and forth on their belly before you take off the diaper. Why do you want to do this? It stimulates them to pee. So this will, especially if you have a little boy, save you from getting peed on. So they'll pee before, and then also you're not changing them to a freshly made diaper, and then immediately they pee. Sometimes they just will, and sometimes they'll poop right after you change them. So what I would start to do was rub this on their belly so that they would pee. Then I'd take off the diaper, and I'd use the front of the diaper to wipe off any of the poop. So I'm using less wipes. So take it off, wipe off the poop. Now I get a fresh wipe, and I wipe them, and then I wait a bit. Because sometimes wiping our baby's bottom, wiping their anus, will get them to poop again also. So then I would just like wait right there, see if they're going to poop for about a minute. Okay, if they don't, I wipe them one more time, get everything off, move that diaper to the side. Then I get the clean diaper. This clean diaper has a stretchy thing in the back, and it's got this Velcro thing on the side. This will go in the back. You lift their legs up, place this underneath them, and then put it between their legs. Now, of course, this is a massive diaper on a tiny doll, but they have the umbilical cord still attached, right? So you're going to fold this part down. On newborn diapers, this part of the diaper folds down to protect their umbilical cord so they don't have that pressure against it. So this is down, and then you're just going to attach the diaper onto the side. Now, diapers also have a line down the middle, and it's usually yellow. When your baby has peed, it will turn blue. And that is one way for you to visually see that this diaper needs changing. When your baby is born, you then also have to pass the placenta, which the placenta is an organ that your body has created in birth. You didn't just like create a human being, you also created a whole new organ. And this organ is connected to them through this umbilical cord. It's this tube that's been feeding them nutrients. When they're born, this tube gets cut. But your baby still has it on their belly button, and they clamp it shut. This is the umbilical cord, and we have to keep it clean and dry and let it fall off on its own. It is said now not to use alcohol on it unless the doctor says so. Sometimes these umbilical cords can get pussy and like yellow and have some discharge. You want to clean it. You don't want that to just sit there. And you want it to air out as much as possible. Personally, I did use rubbing alcohol anytime I started to see that, just to help clear off any chance of infection. But do not pull the umbilical cord off. Let it fall off by itself. It is a gradual process, and it'll take a few days, up to a week, and it will start to come off slightly. It's going to be tempting to just pull it off when it's just hanging there, but let it fall off by itself. One great help to me and my husband was having these shirts for our babies, because this allowed the umbilical cord to be open and we could just put on some pants to cover their legs, but roll it down. And then these button shirts were so wonderful to have until the umbilical cord fell off, and then we moved to bottom tie pajamas. I'll link both of those below, but that was just a lifesaver for the first 2 weeks for sure. Let's get into crying. Babies cry for a reason. Babies use crying as a form of communication. There have been studies on the sounds of babies' cries and the noises that they make, and does it mean something? So there's a theory of 5 cries, and that each of them have a different meaning. Sometimes, though, it is really hard to tell the difference between the sounds of the cries, unless you're like waiting and hearing. But when your baby is crying, you don't want to just like sit and wait and listen. You're trying to solve the problem. So babies are communicating with us. A lot of the times babies are crying in the beginning because they are hungry, or they just want you to hold them, or they have gas. So how do you tell the difference? When they are hungry, they first have started to communicate with you without crying. They've brought their hand to their mouth. They've started licking their lips. They start moving side to side. These are all signs that I would like some food. I'm looking for food. If you feed them then, they won't get to the point when they're crying. But if we wait, they're going to start crying. They're going to get frustrated. That's going to make us feeding them even more frustrating. So look at your baby. If they start to do any of these like early cues of bringing their hand to their mouth, bringing their head side to side, licking their lips, this is all, I would like some food now. Now, after we feed a baby, we want to burp them. You can also take mid-feed burps as well. How do you burp a baby? Now, if your baby has this shrill cry and their tummy is distended or it's like really firm and they're bringing their knees up, this is a sign of gas pain. I have a whole video on this as well as a handout, and you can look at this video for 9 tips of dealing with colic. But gas pains is typically caused by swallowing of air or not being allowed to burp after feed. So slowing down the feed. How do we feed a baby? Let's talk about bottle feeding.
There is a correct way to bottle feed, and that's what we're talking about today. Now, a lot of us learn how to bottle feed a baby through the movies, and it's not correct. In a movie, they'll be feeding the baby like this. Oh, my sweet baby. Just imagine for a second, you're laying down on the ground looking up at the clouds in the sky, and suddenly somebody comes with a jug of milk, puts it in your mouth, doesn't let you come up until you finish it. Can you imagine how uncomfortable that is? Stop doing that to babies. So here's what we do instead. We sit them upright, we take the bottle, and we feed it. The bottle is going to be kind of level, not tilted up, because that just pushes it down, but level. This way the baby can pace the feeding, it mimics breastfeeding, reduces gas, reduces crying, better night's sleep. So, upright bottle feeding. This is how you feed a baby, not like this.
Now with breastfeeding, I have a whole video I mentioned earlier about how to latch your baby, which you can see here. But there are a number of different breastfeeding positions. The most commonly used in these first 2 weeks is a laid back position, especially for mommies who have C-sections or a lot of milk or fast letdown. This can be really comfortable. But it's also comfortable for babies because they're able to pace the feed a little bit more, which slows down them swallowing a lot of air and helps them not overfeed because they're able to stop when they're full. But I just want to talk about your baby's tummy size right now. So this is a chart of what their tummy looks like at the moment. When they are born, It is so tiny. It's like the tiniest little marble. And it fits 5 milliliters of milk at a time. Now, babies eat frequently because their tummy is so small, but their tummy will grow exponentially during this first month. And day 1, day 3, day 7, month 1, their stomach is gradually growing. This is what your baby needs to be comfortably full. A lot of serving sizes that are recommended to parents are actually formula sizes. Why? So when a baby is first born, we've discussed they can fit 5 milliliters of food in their stomach. But the serving size for formula is 2 ounces. We already know the baby can only fit 5 milliliters. Why would we have 2 ounces? Well, because formula is nutritionally static, right? It doesn't change. So for your baby to get the nutrients they need to eat that much. Your breast milk is adaptive and changing. The colostrum, remember, it just comes out as a few drops, but it is so packed with nutrients that they don't need a whole lot to feel full. They don't need a whole lot to be nourished. But if they are formula fed, they do need these servings to not get malnourished. So as your baby grows, the recommended serving size is going to change. Because as your baby grows, they need more nutrients, right? Growing body needs more food. So as they get bigger and bigger, the recommended ounces that your baby is eating is going to get more and more and more. But if your baby is being breastfed, it doesn't need to keep going more and more and more and more. It doesn't have to end up passing the 5 ounce mark, because your milk is changing nutritionally to be more nutritionally beneficial to them in smaller quantities. So what takes 8 ounces to give the adequate nutrition to a baby of formula will take 5 ounces of breast milk. So for the first 2 weeks, this is all you need to look at. This is all the milk you need to make. This is all that they need per feed. And sometimes babies won't want to finish it. And sometimes babies will cry at the end. And we have to figure out, is it a hunger cry or is it a gas cry? If I burp them, are they more comfortable? Just like we figure out for ourselves, am I hungry or am I thirsty? Because sometimes we're just really thirsty. And when we drink a lot, we're not so hungry anymore. Sometimes we do want more food. How do you know if your baby is full? Their hand will relax and they'll unlatch themselves and they'll be calm. Typically, they'll fall asleep because babies sleep a lot, which is a great move to our next topic, which is infant sleep. For the first 2 weeks, what to expect. We adults typically sleep 7, hopefully, or 8 hours, uninterrupted, straight through the night. Babies, especially in these first 2 weeks, are going to sleep around 20 hours of the day. They're pretty much all they do, eat and sleep. That's about it. Now, because their tummy is so small, they are waking up frequently to eat because they're digesting that food and then they're hungry again. This leads to broken sleep for us, which is very hard. It's very hard to go through. And your baby is going to be sleeping so well, most likely during the day, and then up a lot at night. And you're like, what is happening? But this is perfectly normal. We adults have a sleep cycle called the circadian rhythm, which is broken up into 4 different types of sleeps. Newborns, they don't have that yet. They will develop that. But for these first 2 weeks, they have a different type of sleep cycle than we have. Their body is going to adjust, but they will be more wakeful in the evenings. They will be up more frequently in the night, and they will be sleeping so well in the day. And you might get to the point where you are just crying and you're like, why can't you sleep like this at night? Like, I want you to sleep like this at nighttime. They will eventually. But these first 2 weeks, I'm not going to lie to you, it is rough sleep-wise. You will have a lot of disrupted sleep where you are up feeding the baby and then burping the baby and then changing the baby, and then you go back to sleep. So it's typically like you'll sleep like 2 or 3 hours, and then you'll be up for about an hour and then go back to sleep and then just repeat. And it is a very hard season. So if you can get any help during this first, especially the first month, that would be amazing. If your mom or your sister or somebody can come and stay with you and just help you in the daytime so that you can sleep a little bit more in the day and get that rest. This is huge. But this is also the time, as we talked about in our previous video about satisfaction with your partner, this is the time for your partner to also take an active role in the nighttime feeds. So I'm not saying that what we did is what should work for you, but this is what we found worked for us. He would bring the baby to me. I would feed the baby. He'd go back to sleep. Then when the baby is done eating, he would take baby and burp baby and change baby, and then put baby back down to bed. And this worked for us to just feel supported. We were both being supported. We were both being allowed to rest a little bit more. And that just helped both of us feel seen by each other and taken care of. So that is one way to get involved. Otherwise, you can do bottle feedings. You'll figure it out. You guys have the conversation. You decide what works for you. Now let's talk about baby wearing. This is very beneficial because in the Western world, we have babies who cry so much more than other nations that wear their babies. We put our babies down a lot, which then flattens the back of their head, leads to more gas, leads to more separation, leads to them feeling insecure, which leads to them crying more and more and more, and us getting more frustrated and more overwhelmed to where we want to dissociate, and then we have poor mental health. It's a huge cycle, right? One thing that's being found is that these nations where the mommy wraps the baby to her, baby cries less, baby sleeps better. Mommy has a stronger mental health because she has more rest internally as well as baby and mommy are healthier because that time, that bonding together, it really helps with your milk production. It helps with breathing, respiration rate, all sorts of things. It calms the central nervous system. So wearing your baby is a huge, 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 huge benefit, and it can help reduce crying. I'm going to show you how to put on my favorite newborn wrap, which was the Moby wrap, and I've linked that below as well. I wore this every day. There's a lot of different options out there. I chose this one because it's a little bit more sturdy. It's a thicker material, which you're going to find that when you wrap your baby on you, it stretches out in the day. So you have to keep kind of readjusting it. So I really like the Moby. That's what I always used. Now we're walking through how to put on the Moby wrap. So you're going to take, it's a very, very long piece of fabric, and it's stretchy, and it's very comfortable. But there's a logo right there. This logo is going to go right against your chest, right? You're then going to wrap it around, crisscross, take one strap over your shoulder, right? Take the other strap over that shoulder. Oops, let me just make sure I don't cover this mic. All right, now this is what it looks like. I have this strap, which is where the Moby is. I just want to make sure I'm not getting this noisy. And then there's the Moby. Then I have this strap. Just going to move this to the side. Okay. Now, you take both of these and you're going to tuck them inside. Push all the fabric through. This is typically where I find I would need to tighten it once more because what I thought was tight was actually not tight. And how I do that is grab these straps, pull tight. That is going to tighten this across my chest. Pull down. Oops. All right, pull down. Now, you have all of this still. What do? You're going to crisscross again. Now wrap it around your waist and wrap it around and wrap it around until you finally get to where you can just tie it. Then you're going to, grab my baby. Then you're going to take your baby, and you see right here, you have the inside strap. So These straps are crisscrossed over each other. You have this is the inside. This one goes on top. You want to get the inside first. All right, Mike. What do I do with you? Baby on the inside, and you're going to gently put baby in. Tuck baby's knee up. So you want their knees to kind of be bent. You want them to kind of like look like a frog. I wish I could show you with this doll. Look like a frog, and you wrap this fabric around their back. And then you double wrap them, and you put this fabric around that side of their back. And then you triple wrap them, and you pull up that middle part up over. Okay, now your baby is tucked in nicely. I like to pull these down on this side. And then my baby is right here. Tuck their head in. Your baby's head should always be where you can just lean down and kiss them. Okay, this is how high you want your baby, and you want to see their head turned to the side, both nostrils free, mouth visible. I can look down, I can see them, I can kiss the top of their head right away. I don't have to lean down. That is how you wear the Moby wrap. So how do you take the baby out? You just reverse it. You're going to put that one down, hold your baby, move this one to the side, and then hold your baby, put your hand inside, take your baby out. Okay? This was a lifesaver. This allowed me to do dishes, to do laundry, to go for walks, and I would practice that core breathing while wearing this, and that helped me so much. Hope it helps. Next, we're talking about swaddling. But before we do, if this video has been helpful in any way, will you please like and subscribe? That'll keep more videos coming, and hopefully this material will get out to more families so that they can feel confident and ready for taking care of their baby. All right, let's talk about swaddling. Swaddling is when you take this cloth and you wrap it really tightly around your baby, and we have found that it increases hip dysplasia in babies. It leads to a greater risk of SIDS and an increase in weight loss in your infant. So why do we do it? Why do we swaddle babies if we know it is not good for them? Well, because one, it's taught in the hospitals for some reason. Why would it help them sleep better? There are two reasons. One, it stops them from having the startle reflex, which is when babies do this. And sometimes that wakes them up. But two, sleep is a stress response sometimes. Their body is so tightly wrapped up. Heart rates often will go up when babies are swaddled, and they sweat because they're in a stress state, but they fall asleep to deal with it. So sometimes the sleeping is a way of coping with the stress of being tightly swaddled. So how do we swaddle a baby safely? I'm going to walk you through a few options, but honestly, my favorite was just getting the bottom tie pajamas. But let's go through how to swaddle a baby safely to reduce the risk of SIDS, reduce the risk of hip dysplasia, and reduce the risk of weight loss. So to swaddle a baby, you would need a thin, breathable cloth. The muslin is really nice. It's an airy material. And you'll need your baby. I'm going to put my baby over here for a second. And traditionally, you would create like a T, you would create a triangle by bringing one corner to the other corner and making it almost like a triangle on the floor, okay? In a traditional swaddle, you are holding their arms down, you're pinning their arms by their side, you are wrapping them underneath their neck, holding that arm down, put it under this other arm. Now wrap that other arm, and baby cannot move. This is not ideal because of the pressure it's putting on the hips, but also if your baby rolls, now they cannot push themselves at all. They are stuck face down. And you know with a newborn, they have no neck control. And sometimes, yes, it is not common for babies to roll so early, but some babies do. Some babies do. So what do we do instead? If we want to do a swaddling, we'll put our baby up, We'll let their arms be completely free, because this also lets them give us the hunger cues. They can bring their hand to their mouth. They can let us know that they're hungry. They can reach out. They can have their hands free. With their legs, we can bend their knees. I can't really do it with this doll. To kind of tuck them up, right? We're not tightening the swaddle around straight legs. We're kind of bending their knees up a little bit. That's also going to help them get some gas out. And then we're just going to loosely wrap it. It doesn't have to be super tight. Wrap it around, tuck this half underneath them. Right? I have a lot of fabric and this doll is very tiny. And then wrap this around them. And then you can, with a bigger baby, but also a smaller cloth, can tuck this then in the back. And that will provide them with the ability to be comforted and swaddled, but their arms are free. How do you bathe a baby? Well, that first week, they have their umbilical cord, right? So you don't want to submerge them in water. You don't need to give them a full bath. What we'll do instead is just a gentle wipe down. Get a clean rag, get some warm water, and just wipe their body. Make sure we wipe under their neck, behind their ears, because when they spit up too, that milk can get trapped. But behind their ears, all around every crevice, and just wipe them down. That's all you need to do. When you are ready to bathe them, which is when their umbilical cord has fallen off, then you can submerge them in water. One tip that can really help make bath time more comfortable, one is warming up the water so they're not in a cold bath, but two is placing that same thin material cloth on them during bath time. I don't know if you've ever been sick and you've had like a fever and you want to go take a bath. If I sit in the bath, I start to get chilled, right? I start to feel a little cold. But when I'm sick, what I'll do is I'll bring in a towel with me and I'll wet up that towel and I'll place it on top of myself. And it provides so much comfort and it helps maintain that body heat and that warmth. So this is what we're doing for our babies. We're giving them that comfort and we're keeping them warm. Now, some mom tips. These are things that people recommended to me that made the biggest difference in these first 2 weeks. Number one is a basket. Having a basket by your bed that's already filled with diapers, wipes, cream, snack, water, change of clothes for you, a rag, whatever it is that you'll need in a moment, it's all right there. So you don't have to go and get it. We kept one basket by the bed, one basket downstairs, wherever we spent the most time. And that was just, I was so grateful. Every time I needed something and it was right there. I was like, man, I'm so glad we have this basket. So get a basket filled with all the things that you're going to need. Tie bottom onesies. Once their umbilical cord falls off, I used these for months. This was amazing. These clothing, this type of baby clothing, you know, like people are always like, don't buy the clips, buy the zippers. Skip the zippers. Buy the bottom tie pajamas. This is a lifesaver. Another thing that absolutely transformed my breastfeeding experience was the haka. Getting the haka. I'll link all of these below. These are just, and I'll also link some cute baskets too. Take a lot of pictures. They grow so quickly in the first few months. They change so drastically. You won't regret having 1,000 pictures of your baby on your phone, especially as they get older and you look back at it. Take as many pictures as you want. Have somebody come and take pictures of you with them and eat some nourishing food. Because if you're breastfeeding, your milk is going to supply all the nutrients to your baby that they need, but it's going to take it from your stores. So keep your body fed and nourished. Your only job right now is to feed yourself, feed your baby, and rest. And that is all you're going to feel like you do. And that's exactly what this season is meant for. Now, I have something really exciting I have been working on. I want to create the ultimate 90-day guidebook for mothers to navigate those first 3 months with baby. Your one resource to go to so that you can feel really confident and that you can actually enjoy this season. And I have begun working on it and I love it. I wish I had it. I wish I had made it for myself when I was going through this, but I hope it is just so helpful to you. If you want to be notified when it's available, join the link below. I hope this has helped. If this has helped in any way, please let me know. Love ya. See you, pizza.